getting a lot of good info? Good. Well, I'm going to introduce our next speaker, which is a personal story to me as well, because she's one of my dearest friends. They went through a lot, and she's going to share that with you. This is Melissa Taylor.
Forward to 2009, Jamie was finishing up here at medical school, and we started talking about starting a family, and decided that following year that we were going to start trying. So, of course, throughout that year, I started, diligently tracking my cycles and doing invasive ultrasound, making sure I did that a few times just to make sure that I was ovulating and things like that, because I always knew that my cycles were pretty long and irregular. Although it seemed pretty normal to me, especially since I thought, I was ovulating and everything was going fine there. So when it came time to try, or during that year of tracking, I had my well-woman checkup, and I told my doctor that, we wanted to start trying to have a baby, but I was on cycle day 27, and I had not ovulated yet. So she took me in for a transvaginal ultrasound, where it showed that I hadn't ovulated yet. And of course, the texts, don't really tell you very much. The doctor will call you. A few days later, I got a call, and the nurse said, if you want to try to have a baby, your doctor recommends that you go see a fertility doctor. So, with that news, deep down, I always kind of knew that I might struggle to have a baby, but that just kind of made everything more real there. And we just kind of took that information, and we didn't jump on it right away because we wanted to try on our own, just to see what would happen, because, I tracked my cycles, I knew I was ovulating, and then 14 days later I get my period. So we tried on our own, and after negative test after negative test after negative test, I thought, well, maybe we should just go at least have a consultation and just see what's going on. So we went in, met with the doctor, and based off symptoms alone, pretty much showed that I probably had PCOS, which I had heard about before, but I didn't really think that that was me, because of course I get on message boards and things like that, like probably some of you have before, where it showed, from what I could tell, usually people struggle with their weight as well. So I thought, well, I don't struggle with my weight, so surely that's not what I have. So I learned a lot that day. They also did a transvaginal ultrasound where it did indeed show that I do have polycystic ovaries. We were given our treatment options, and we wanted to start with mixed invasive first. So we went home with a Clomid cycle, or Clomid prescription that night and started Clomid. And we did timed intercourse. That failed. We did it again, timed intercourse. That failed. We decided, or in the meantime as well, my husband got a sperm analysis where it showed that he was perfectly fine, so there was no issues on his end. Then we decided timed intercourse wasn't working for us. Not that insemination would increase our chances by much, but we figured if we were going to start, heavily paying out-of-pocket expenses, that we wanted to make sure that this place was exactly where it needed to go. So I did the HSG just to make sure that my tubes were blocked, or working forward with that, and it showed that my tubes were clear. So the next cycle, we told me it was an IUI, and we didn't get pregnant. Did it again, and we didn't get pregnant. At this time, we figured it was time to move on. So we started injectables with IUI. Again, money, we figured, let's just do an IUI, maybe it'll help me feel a little less stressed as well. We were fortunate on October 9th to find out that we indeed were pregnant off of our first injectable cycle. We found out right away that our HCG levels were low, and this might not be a viable pregnancy. And 5 weeks, 3 days, I ended up miscarrying at home. wish that upon anybody. And many of you in this room might have experienced that already. It's just some new ones that don't ever want to go through. After that was done, the best thing for me was to keep moving forward. And I needed to know what our next plan was because I wanted that baby. So we decided we were going to do another injectable cycle because it worked the first time. Why wouldn't it work the second? So we proceeded. It was in December of 2011, and of course testing day was right after Christmas. The morning after Christmas, I tested, and much to my surprise, we were pregnant again. So I really thought this was our miracle drug, and that this was going to be it. We got our levels tested, everything. It looks great. We scheduled our 6-week, 3-day ultrasound. I made it past 5 weeks, 3 days, so I thought everything was going great. Got to 5 weeks, 6 days, and I woke up one Saturday morning and started feeling crampy. Told my husband, I think, I'm cramping, but it could just be normal pregnancy. I didn't know how it felt, but I didn't know what to expect or anything. So I just laid in bed, and then I decided I need to go to the bathroom, and then I made that dreaded walk to the bathroom, saying the prayer, please don't see any blood. Went to the bathroom, and sure enough, there was blood. Just knew everything was over once again. This, I'm questioning myself, why can't I carry a baby? What is wrong with me? Paged our doctor, let him know. He upped my ultrasound for first thing Monday morning. Said if anything else happened, he'd give him a call back. Probably 20, 30 minutes later, I started cramping pretty good, and I was to the point where I was pretty much hunched over. And what I was feeling was severe rectum pain. And I didn't know what that was because I didn't have that with my first miscarriage. So I was like, maybe I have a hemorrhoid or something. I never had one, but maybe that's what it was, or that's what I wanted it to believe that it was. We ended up going to the emergency room. After hours of being there, they confirmed that it was an ectopic pregnancy, which was the baby is in your tube. I was transported to my doctor's facility to confirm what they were seeing, and then we'd have to take our next steps. I ended up having emergency laparoscopic surgery that evening, so they could remove the pregnancy. And of course, it's just another setback that we had to go through. After meeting with our doctor to figure out what our next steps were going to be, we were told that we needed to do another HSG. My tube was safe, but you just never know when you have a surgery like that. If your tube would be open or scar tissue or anything like that. So we went in for another HSG. It showed my tubes were clear, except for my right one that was operated on was constricted. And because we had an ectopic pregnancy, we were at a greater risk of having another one. And so basically it was our call. We could do another injectable cycle, or we could go straight to IVF, which seemed to be the safest route for us. So we chose to do IVF. We started that process in March of 2012. We retrieved quite a few eggs. I think 21 was our first. Not, of course, for all of them were, had eggs in them or whatnot, but placed 2 in, and 2 weeks later, of course, I always tested at home before the doctor. We have to go in there and do your blood test, and it was negative. And it was just awful to know that we went through this IVF cycle, thinking he thought we were golden, that this was going to be our ticket to our baby, and it just didn't happen. We were only able to freeze 1 out of all of those that they retrieved, and we talked with our doctor again to see what our next step was going to be. We honestly didn't think that we'd be doing another fresh IVF cycle, but we chose to go ahead and do another fresh cycle. We did have 1, but the chances of it surviving, from what I've heard, are great. But I've known so many people who get prepped for their frozen transfer cycle, and then the embryo not survive. IVF doesn't totally take out any rare growth factor into the tube. So we saw that one implanted, and we had one scare. We thought we were losing the baby again. At 5 weeks, 6 days, I called him. He was at work. I was at work. We were just a mess. We ran to the doctor, got an ultrasound, where we saw our baby's heartbeat. So we knew we had crossed yet another hurdle, even though we knew we weren't safe yet. But we were, crossing everything we had that this one was going to stay with us. And then on March 18th, 2013, we delivered our sweet baby, Violet Sophia, who just turned 1 last month. Our hope one day is, to obviously give her a sibling. But I know how I felt going through this journey, and those feelings obviously are still with me. And I can only imagine what some of you, the hurt you're going through and the sadness that you're feeling. But don't give up, because it will happen. If you need support, there are tons of support groups out there. Just don't give up. Just keep fighting for what you want, because one day you will get it. Some way, somehow, you will get there. And if anybody, needs support, I'm an open book. If you have any questions for me, for us, feel free to find us after the session. We'll be glad to talk to you.
Oh, no, I thought it was great this morning. I came here the first year, and from the men that were here the first year, there wasn't a lot of men. There wasn't a lot of men's faces here. I kind of got drunk here. I thought the guys did a great job this morning to all you guys. Spread the message, telling, about the different stories. Men handle it differently than women do. We obviously know that we're two different people. I work as a firefighter and paramedic. My job is to be a problem solver, and I'm really good at that. But this is something, you can't fix. You got to be there to support your spouse, Questions come up, and still we have family ask us questions about, well, when's the next baby? They forgot. We still live with this all the time, deal with this, remember, but, they see our perfect child and not having any issues now. Well, when's the next baby, So I've had to use humor for that, too. It's like, well, we still got some on ice, so we still got some. And then they kind of remember, oh, we're so sorry. And so, humor's a good thing, and I thought everybody that spoke this morning, all the men did a great job. So. But if you have any questions for me, feel free to ask. Thank you.
You guys will get your miracle.
Now we're going to have Dr. Marsh come up and talk to us about some polycystic ovarian syndrome.
First, I want to thank Jay and Martha, and thank you so much for your support. have all three of these. That's the other thing that's confusing. You don't have to have high male hormones, or you don't have to have irregular periods even. You just have to have 2 out of 3 of those symptoms in this little box here. So if you kind of fall into this category here or this category here, you still have it. You don't have to be in the middle and have all 3 things. So that might be why it's a little bit confusing. Like you may not look like the next person who has PCOS, and that's okay. And a lot of people do have PCOS. You're not alone. It's about 10 to 15% of all reproductive age women do have this. So it's not a one-size-fits-all diagnosis by any means. So what are polycystic ovaries? What does that mean? So if you are going to a doctor's office and you're trying to diagnose this, this is kind of what you'll see if you do have polycystic ovary syndrome. So you can see these little black circles around the ovary. Sometimes they call it out like a string of pearls is sort of what it looks like. And that can mean that you have polycystic ovaries. Technically, you need to have 12 or more follicles on one ovary to meet that definition. But that's what we're looking at, and that can kind of give you the idea of, oh yeah, I have a lot of eggs and I have polycystic ovaries. Does that mean you necessarily have PCOS? Not necessarily. heart rate restrictions on it, your BMI decreased by over 2. So these are all signs of hope. This can work for you, so keep trying. Work with your doctor if you're struggling with this. Is there an obesity pill? Yes, there's a lot of obesity pills. So some of these are ones that I use a lot in my practice, other ones I don't. Orlistat is the one I think it's over the counter now, but it can have some kind of untoward side effects. So it's like having fatty stools or leaking stools during the middle of the day, which I don't think that anyone wants
kid ready to parent, or, how early can that be detected?
Yeah, that's a great question. So the question was, when can we diagnose PCOS? I mean, is this something that happens later in life, or you always had it? It's probably right, you always had it. A lot of people have always had irregular cycles. And it's hard to diagnose when you're going through puberty, so it's tricky. So for the first 2 years after you have a period, your cycles are going to be very irregular, and that's normal because your body's trying to get into the groove of ovulating every month. After 2 or 3 years, you should be having normal cycles, so that's usually the time when a doctor will start to take a look and say, what's going on, why are you not having cycles every month? And so it can be diagnosed if you're a teenager, but it's a lot trickier.
So I wanted to know if recurrent miscarriage is a common problem with PCOS, and what should be the next step if you've explored every possible option like Clomid and IUI and IVF. Personally, we have experienced miscarriage with each possible option, and we don't know like what are the next steps. So,
Yes, that's a great question. The question was talking about miscarriage with PCOS. That's something I probably should have had a slide on. So the chance of having a miscarriage with PCOS is higher. And they're not exactly sure why that is. It may be due to the hormones, that there's a regulation of hormones is not quite normal with PCOS. But your doctor will probably talk to you. Having miscarriages is a complex problem. A lot of times they do not recommend you with PCOS, and you might do other tests to check to make sure that nothing else is going on with you. Some people are going, if everything else has failed, to try to do the PGS to talk and see if it's a chromosome problem. But that's something that I don't think there's a great answer for, unfortunately. But it's something to talk to your doctor about and see if they have other options, because it may they require an individual answer for you guys.
I have insulin resistance, and I've really had a little bit of insulin in my mind. A lot in that format. But I've never had any problems with my blood sugar. Is that something that eventually I will start to have a problem again?
Yeah, that's a great question. So she is talking about being insulin resistant, and how does that relate to your blood sugar? So how diabetes progression works is that's the first step, is that your insulin levels start to really ramp up to control your blood sugar. So right now your body's doing what it can to control the blood sugar, and you're in that pre-diabetic phase. So if you don't take medicines, or if you aren't working on eating healthy and exercising and all that good stuff, most likely you will develop diabetes because your pancreas can only produce so much insulin, and at some point you wear out. But by controlling it with your weight and your diet.
Has there been a study done in terms of having to have a recurring rate of pregnancy with PCOS?
So the question is about repetitive miscarriages, is that what you're?
Or is the first part?
Oh, to start your,
To start reviewing.
oh, okay. So this kind of goes back to people are talking about using a DNC for people with PCOS. So a lot of times, one of the things I didn't talk about as much, but cancer is one of the things that we're worried about with people with PCOS. A DNC is a procedure where they take out the lining of their uterus, and if your lining is really thickened because you don't have periods regularly, it does two things. It kind of gives you, like you said, a fresh start of growing the lining again, but it also checks to make sure you have precancerous cells. So the doctor may recommend that for you, but there's also things that you can do after doing that initial DNC or initial biopsy to make sure you don't have cancer, to not have to go through that process over and over, like hormone control and things like that.
If you have someone that comes into your office and has PCOS and they're considering starting to try and get pregnant, but they haven't tried yet, would you recommend trying naturally or going straight to fertility medications, knowing that they have PCOS but haven't tried?
That's a great question. So if you know you have PCOS already and you're thinking about getting pregnant, should you just go naturally or see your OB/GYN, or should you see a fertility specialist? And at our clinic especially, I know that if you call, Carol is our receptionist, if you call her and see you have PCOS and you're trying to get pregnant, you can see us immediately. So because it's going to, if you're having irregular cycles like that, if you try naturally, it may take you 2 or 3 years instead of 1 year. So
when we started out this morning, and for some closing remarks and one final drawing for giveaways.
Okay.